I work at a large teaching hospital in Toronto, and I primarily take care of patients who are admitted to hospital, and a very large proportion of the patients I take care of are admitted to hospital because they aren't taking their medications as prescribed. There are a lot of reasons why patients don't take their medications as prescribed, but a big one is cost. In Ontario, people who are over 65 and people who are receiving social assistance payments, they get their medications for free. But a lot of people fall through the cracks, particularly people who are self-employed, taxi drivers, nannies, people who run small businesses, for example, and people who are out of work but who don't meet criteria for welfare. And so I take care of a lot of patients who fall through the cracks. And we quite frequently see patients who have stopped taking their medications because they don't want to pay for them anymore, and these patients end up in hospital. So for example, I recently saw a patient who had become unemployed, and he did not have either private or public coverage for prescription drugs, and he had simply stopped taking his medications for high blood pressure. And as a result, his blood pressure started to increase until the point that it started causing headaches, and he ended up in hospital. This particular patient, I think, had a choice between either paying for his medications or paying for something else that he felt was necessary. I'm not sure whether for him it was a choice between medications and food, or a choice between medications and an after-school program for one of his children, or a choice between medications and meeting his utility bills. But the fact is, in a country that is as wealthy as ours, we shouldn't be asking patients to make those choices. We should have a healthcare system that provides essential medications for everyone. The beauty of universal coverage is that it covers everyone, whether you're rich or poor. And we have universal coverage for physician services and hospital services in Canada, but we don't for prescription drugs. And what happens in a province like Ontario is obviously we don't really need to worry about those who are wealthy. And people who are very poor have access to publicly funded prescription drugs. But a sizable proportion of the population falls through the cracks. And in fact, a colleague of mine, Michael Law, at the University of British Columbia, has done research to suggest that about 10% of Canadians have trouble affording their prescription drugs and might not take their prescription drugs as prescribed because they can't afford them. And when you think about that, that's a huge chunk of the population. What's been covered under Medicare since the 1960s are physician services and hospital services. And prescription drugs that are provided in hospital have been covered since the beginning. And when people were primarily seeking medical attention for acute illnesses, and expensive drugs would have been delivered primarily or exclusively in hospital, it wasn't a big deal that we didn't have comprehensive prescription drug coverage. But over the last half century, there's been a dramatic increase in chronic disease, largely a result of us being successful at treating acute illnesses. But what that means is that there are millions of Canadians who are dependent on their prescription drugs to maintain their quality of life and to maintain good health. And it really makes no sense to pay for these folks when they go see a physician or when they're admitted to hospital, but to not pay for their prescription drugs. I think if we were starting afresh or developing Medicare now, there's no way we would exclude prescription drugs. It's really a historical mistake that happened in Canada, and it's one we should try to rectify.